80% of people with a certain fingernail shape have lung cancer. Your doctor knows this, and knows things about your heart and hormones, not from tests, from looking at you. The color of your eyes, the shape of your nails, the way you walked in. Here are 8 things doctors can tell just by looking at you. Number 1, yellow eyes. Your eyes are tattling on your liver right now. That's not a metaphor. The white part of your eye, the sclera, is one of the first places doctors look when they suspect something's wrong with your organs. If there's a yellow tint, even a faint one, that's bilirubin. It's a yellow pigment your body creates when it breaks down old red blood cells. Normally, your liver processes it and flushes it out. When your liver can't keep up, the bilirubin backs up into your blood, and your eyes turn yellow before anything else does. Here's what's wild. Doctors know to check under your tongue first. That's where the yellow shows up even earlier than your eyes. Most people never think to look there. But if your liver's struggling, your tongue knows before your mirror does. Yellow eyes can mean hepatitis, gallstones, fatty liver disease, or something worse. The point is, your liver's idea of sending up a distress flare is turning you into a human highlighter. And most people ignore it until their skin starts matching. Number 2, fingernail clues. Your fingernails are keeping a detailed diary of your internal organs, and doctors know how to read it. See that little white crescent near your cuticle? That's your lunula, the moon. Most people have them visible on at least their thumbs. But if you can't see any moons on any fingers, that might mean anemia, B12 deficiency, or even kidney problems. But here's the bigger one. If your nails are starting to curve downward and the tips of your fingers look swollen, that's called clubbing. And 80% of people with finger clubbing have lung cancer. There's a simple test doctors use. Press the same fingernail from each hand together, nail to nail. If you're healthy, you'll see a tiny diamond-shaped gap between the nail beds. If that gap is gone, you might have clubbing, and you need to talk to someone. A man named Brian Gemmell had no cough, no chest pain, no breathing problems. His only symptom was weird fingernails. His GP recognized the clubbing and sent him straight for a chest x-ray. They found lung cancer early enough to save his life. His fingernails ratted out his lungs. Number 3, tongue color. Stick out your tongue and look in the mirror. If it's pink and slightly moist, you're fine. If it's purple, your blood might not be circulating properly. Could be a heart issue. Could be you're just cold. But if it's been purple for days, that's not normal. A thick white coating that looks like cottage cheese usually means oral thrush, a yeast overgrowth. Your mouth just announced that your immune system is struggling. And here's one most people miss: scalloped edges. If your tongue has little indentations along the sides, like it's been pressed against your teeth, that can mean sleep apnea. When you sleep, your tongue might be pressing forward to keep your airway open. So, you wake up with teeth marks on your tongue. You didn't even know your body was fighting to breathe all night, but your tongue kept the receipts. Number 4, the white ring. Look closely at your eyes, not the white part this time. Look at the edge of your iris, the colored part. If you see a white, gray, or blue ring circling it, that's called arcus senilis. It's made of cholesterol, literally. Fat deposits building up in your cornea. Now, here's where it gets interesting. If you're over 50, it means nothing. Almost everyone gets it eventually. It's just aging. It doesn't affect your vision. But if you're under 40 and you have that ring, doctors pay attention. Studies show people under 50 with that ring have a 4-fold increased risk of high cholesterol. It's associated with familial hyperlipidemia, the kind of high cholesterol that runs in families and causes heart attacks young. So the same ring means 2 completely different things depending on your age. At 70, it just means you're 70. At 35, it means your cholesterol might be plotting against you. If you're finding this interesting, consider subscribing. I drop videos like this regularly. Anyway, back to it. Number 5, facial hair. This one's specifically for women, and it's not about beauty standards, it's about hormones. If you're growing dark, coarse hair on your chin, upper lip, chest, or back, in a pattern that looks more typically male, doctors call that hirsutism. And in 70 to 80% of cases, it's caused by polycystic ovary syndrome, PCOS. Here's how it works. Your ovaries produce some amount of androgens, male hormones. In PCOS, they produce too much, often because of insulin resistance. The excess insulin tells your ovaries to go overboard on testosterone, and testosterone tells your hair follicles to activate. The location matters too. Research shows that women with facial hair on both the upper lip and chin have significantly higher insulin levels than women with hair in just one area. That chin hair isn't random, it's a signal. And if you also have irregular periods, acne, or trouble losing weight, you might want to get tested. Because sometimes your face is the first thing to tell you your hormones are out of balance. Number 6, walking gait. Your doctor started diagnosing you the moment you walked through the door. The way you move says more than you think. Depressed people walk differently. That's not poetry, that's data. Studies using 3D motion capture found that people with major depression have shorter strides, slower speed, reduced arm swing, and a slumped forward-leaning posture. They don't push off with their feet the way healthy people do. They lift their legs instead of propelling forward. Quick reminder, if you're enjoying this, subscribing really helps out. Now, where were we? Machine learning models trained on Gait data can now detect depression with over 90% accuracy. You thought you were just walking into the office. Your brain chemistry was putting on a show. A shuffling walk, stooped posture, and low energy can also suggest Parkinson's disease, sometimes before tremors even appear. For psychiatrists and neurologists, the walk is the opening paragraph of your diagnostic story. Number 7, skin color. Your skin is broadcasting your blood sugar, your iron levels, and your oxygen supply. Doctors know how to tune in. If you look pale, especially in the creases of your palms or the inside of your lower eyelid, that can mean anemia. In people with darker skin, the inner eyelid is often the only reliable place to check. If you pull down your lower lid and see vibrant red, you're probably fine. If it's pale pink or yellowish, your iron might be tanked. Then there's acanthosis nigricans, dark velvety patches of skin that show up in the armpits, groin, and back of the neck. It looks like dirt that won't wash off. But it's not dirt, it's insulin resistance. Your body is producing so much insulin that it's making your skin cells multiply. And in children and teenagers, it's now officially considered a risk factor for type 2 diabetes by the American Diabetes Association. That dark patch on your neck isn't a stain. It's your pancreas putting in a help wanted ad. Number 8, eyelid deposits. Last one. And this might be the sneakiest. Look at the inner corner of your eyelids. If you see soft yellowish bumps or flat patches, that's xanthelasma, cholesterol deposits that have literally surfaced on your skin. Now, about half the people with these have high cholesterol. That makes sense. But here's the twist. The other half have completely normal cholesterol levels, and they're still at higher risk for heart disease, heart attacks, and atherosclerosis. Researchers think inflammation might play a role. So even if your numbers are perfect, those yellow bumps are your body's way of saying something's building up inside. Doctors are now being told to treat xanthelasma as a clinical clue, not just a cosmetic issue, because your eyelids might be warning you about your arteries. And most people just think it's a weird skin thing. Your body is talking. Your eyes, your nails, your skin, even your walk. All of it carries information about what's happening inside. The question is whether anyone's listening. Thanks for watching. If you enjoyed this, subscribe and hit the bell so you don't miss the next one. See you.